So staff at Throckley were near breaking point. They were actually on their knees. They had so much work coming in, and even though their patients said that they were consistently producing really good results for their patients, the staff were on their knees. The doctors were absolutely exhausted. They were dealing with sort of in excess of 50 items in their mailboxes a day. The delay that was caused by those not accessing their mailboxes all the time was then passed on to the admin staff, who had huge amounts of work to do when they decided they'd get on and do their mail. There was no specific time for any scanning. There was no allocated time. There was just so much scope for mistake. It was, you know, wasn't good. The SHA discovered Virginia Mason production system and thought it was absolutely wonderful. It was all fluffy clouds and ice cream, and so they thought that they would roll it out to organisations in the Northeast and say, how do you fancy clubbing together, getting some training, and we'll really go for it and make some lean working happen. These are the improvements that we made. All patient is seen by a GP within 2 hours of arriving at the surgery. I think that's pretty unique, probably across the UK, to be honest. I don't think any GP practice in the UK would see their post within 2 hours of arriving at the building. An 80% reduction in the mail process by clinicians. 72% reduction in GP contact with mail. That's the equivalent of 3 calendar months of a GP. If you work that out, if this process was replicated across the north of Tyne for every single GP practice, that would be the equivalent of 30 full-time GPs, just with this one little process. And a 34% reduction in administration time. And a reduction from a 10-day process down to 1.2 days.